And AMA President Dr. Andrew Pesce joins me now. Let me quote from your report, Doctor. Our public hospitals need more beds, more doctors, more nurses, more infrastructure. That's quite a wish list.
It is. It's not just more, it's also using what we've got better. So there are targets that the governments have agreed to perform by, but they're not meeting them, even by their own standards.
But you also say it would be a grave mistake for governments to think that reform is simply about the hospital system doing more with less. But that's how the system is working now, isn't it?
At the moment, there's no fat left in the system, and that's why if we're going to increase capacity, we need to fund it better. The federal government has committed to funding public hospitals and injecting funds to open beds. We need to see evidence that those beds will be open to allow us to achieve the capacity that we need to treat our patients in a timely manner.
But we've heard dire warnings from your group before. I remember doing an interview with your deputy a couple of months ago. What's different about this report?
I think this is using the various state governments' own targets and showing that even by their own criteria, performance is getting worse. The reason why I think this is timely is we're coming to the time where the Prime Minister promised he would act on public hospitals. We've been waiting patiently, we haven't put him under pressure. He himself said he has to talk to the state health ministers in November. They have to come to agreement about what they're going to do. If they can't come to an agreement, he'll go to the people to get the power to do what needs to be done. But the Australian people and the doctors and nurses of Australia are looking to the Commonwealth Government to implement that election pledge and finally sort out the problems in our hospital system.
How do you overcome the blame game in this dispute?
I think it's by clarifying the roles. It's one of the reasons the AMA finally has decided to support a single funder. So if you think about the Commonwealth Government, which actually does collect the taxes, the taxpayer is the single funder of our health system. But the way that the funding is distributed means that money can disappear into black holes in an unaccountable fashion with no one being responsible. We're calling on the Commonwealth Government to clarify its role and become the single public hospital funder. The state governments continue to operate the public hospitals, but with clear performance targets. So if the funding isn't adequate, we know who's to blame. If the performance isn't satisfactory, we know who's to blame. At the moment, everyone just shifts the blame.
Finally and very quickly, would you be at all surprised if we're having the same conversation a year from now?
I'd be very disappointed. I think that the head of pressure is stronger than it's ever been, and I think that everyone expects that the governments on this occasion will act to...
And if they don't?
If they don't, things will get worse and patients will suffer.
Dr. Andrew Pesce, thank you very much.
Thanks, Jim.